There are currently no COVID-19 vaccines available in Alberta. Our province and others have pulled the shots at Ottawa's request to make way for more updated formulas that target new strains of COVID. But as Terry Fikowski reports, the new vaccines have yet to be approved in Canada, and that is leaving a gap in access.
If you're looking for or due for a COVID shot in Alberta, you're out of luck, at least for now. Pharmacies have returned their stock to the government.
I think we had probably about 4 or 5 bottles that we had to get rid of them.
The province says it has withdrawn an order the vaccines destroyed at the directive of Health Canada, as has Ontario, Saskatchewan and Quebec plans to do the same. A new vaccine is still in the approval process, but the Public Health Agency says it is in touch with provinces and territories to ensure continued access is available and has reserves if needed. A memo from Ontario's government suggests new doses will be distributed in Canada at the end of the month, leaving around a month of a gap, though experts suggest it will be worth the wait.
I'm trying really hard to think of a person for whom I'd recommend getting the last year's vaccine right now, when we know that the new one, which we expect will provide better coverage against the dominant circulating COVID, is available, hopefully in October. So there'd be very, very, very few cases where it would make sense for someone to take the current vaccine.
Dr. Lenora Saxinger says it helps that we're facing a different landscape than even a year ago thanks to immunity. According to provincial data, there have been nearly 30,000 COVID cases between August 2023 and 2024, down from the previous season. Hospitalizations are up slightly, but the number of people in ICUs is down and deaths have dropped by 25%.
That vaccine protection kind of peaks about 4 weeks after the dose and then kind of drops off. So those people who are higher risk would still be at high risk now, and they would be prioritized for getting the vaccine again in the fall.
Kanji hopes COVID shots can be given out at the same time as the influenza vaccine, saying there is already a reluctance from clients.
The interest is not that great anymore. I think people may be tired of it, and also there's not too much information out there to encourage people to take more shots.
He continues to encourage people to stay home if sick and test for COVID, with the risk of increased transmission this fall before a new shot is available.
Terry joins us now. Terry, this comes as the federal government collects information on people's attitudes toward vaccines.
Tara, some people will begin to receive or may have already received a letter in the mail with a survey code that is asking them to participate in a national study on immunization coverage in Canada. It's being conducted by the Public Health Agency of Canada, looking for 20,000 people to participate, adults from randomly selected households. It has been conducting this survey since 2001 to get a better idea of vaccine programs and people's attitudes towards them across the country. For the 2023 survey, results showed coverage of routine vaccines range from 87% for measles to about 6% for mpox, with 18% of adults reluctant to get routine vaccines. Tara?
Interesting. Okay, Terry, thank you.